let's talk about how to get the benefits from vitamin D without that toxicity. Now, the danger of vitamin D really stems from calcium. Hypercalcemia, too much calcium in the blood. See, vitamin D helps absorb calcium by 20 times in the small intestine. So we're going to get a spike of calcium in the blood. And so hypercalcemia is really the big side effect of having too much vitamin D. And that could potentially lead to kidney stones, constipation, frequent urination, dementia, depression, an ulcer, abdominal pain. And just FYI, if the person stops taking vitamin D, it's reversible. Okay, so that's one point. Second point, it's very rare to have someone with vitamin D toxicity. And this is stated by the Institutes of Medicine as well as the Endocrinology Society. Now, when you measure vitamin D in the blood, if it's greater than 150, that would indicate toxicity, especially if it's taken with some type of calcium in the form of, could be some dairy or milk. All right, a couple things you want to know. Vitamin D doesn't work by itself. It needs other things. It works with vitamin K2. So I always recommend taking vitamin K2 with vitamin D because vitamin K2 keeps the calcium out of the soft tissues, like keeping calcium out of the arteries, keeping calcium out of the joints. So with vitamin K2, you want to take 100 micrograms, not milligrams, for every 10,000 IUs of vitamin D. Okay, that's the ratios. All right, number two, bile salts. Bile salts are very, very important in helping absorb vitamin D. So if a person doesn't have a gallbladder or they're deficient in bile salts, they could have a problem getting enough vitamin D. And that can show up not necessarily in the blood, but it can show up in the conversion of the active form of vitamin D, which I'm going to get into in a second. Number three, if you're drinking at least 2.5 liters of fluid a day, that should be enough to keep the calcium from forming kidney stones. Just that alone. All right, number four, magnesium. Very, very important in the metabolism of vitamin D. In fact, magnesium and vitamin D work together. And then number five is limit the amount of dairy that you consume when you're taking a lot of vitamin D if you're concerned about developing hypercalcemia. So if you're not consuming any dairy and you're drinking enough water, you're not going to get hypercalcemia because there's not enough calcium in the diet to give you that problem. Now, as far as the amounts of vitamin D that I recommend, vitamin D3, at a maintenance dosage between 10,000 and 20,000 international units, okay? Now, for those people that want to take more than that for therapeutic purposes, let's say, for example, they have an autoimmune condition, or they have pain and inflammation, or they have high blood pressure, then you'd want to take a little bit more, between 20 and 50,000 IUs. And it's done on a short-term basis. Maybe you do it for a month or two. Now, I want to come back to the point on someone developing toxicity from vitamin D and it being rare. There's several studies out there that state that you would have to consume hundreds of thousands of international units of vitamin D for months for you to develop hypercalcemia. Now in the 40s, they used 200,000 to 300,000 international units of vitamin D3 to treat TB and rheumatoid arthritis. And yes, there were some side effects, but they dealt with them. So this whole idea of taking, 10,000, it seems like such a lot, or 20,000, it's actually not as much as you think, because if you convert the international units to milligrams, you'll be shocked to see how low they are. Now, I've talked about toxicity, but let's mention about deficiency and insufficiency, okay? A deficiency of vitamin D is extremely common, and that would be a measurement of less than 20 NGs per milliliter in the blood. And insufficiency is less than 30 NGs per milliliters in the blood. And so a normal amount of vitamin D in the blood should range between 30 and 50 NGs per ml. And what's interesting is 65% of the population has a vitamin D deficiency, and 95% of the population has a vitamin D insufficiency. Now, one last point before we go. When they test your vitamin D levels, they're not testing the active form of vitamin D. They always, well, not always, most of the time they test the pre-vitamin D, which is the inactive form. In order for vitamin D to be converted to the active form, you need the liver and the kidney to work correctly. So just realize that when they show high levels of vitamin D, that is the pre-vitamin D, not the active form. This is why it's good also to measure the active form of vitamin D occasionally. All right, thanks for watching. Hey, before you go real quick, I have a course entitled How to Bulletproof Your Immune System. It's a free course. I want you to take it, and here's why. Here's you. Here is your environment. Everyone is focused on this over here, avoiding your environment. But what about here? What about strengthening your immune system? That's what's missing. This course will show you how to bulletproof yourself, and so you can tolerate and resist your environment much better by strengthening your own immune system. I put a link down in the description right down below. Check it out and get signed up today.